so delighted to extend our warmest welcomes to our incredible guests and thrilled with a number of our community partners that are here. And I've already had a chance to meet some people that I've wanted to meet for a very long time. So just going to be a very, very exciting day. MCHRI has had a wonderful year. Just some highlights: we awarded 164 grants over the course of the year, amounting to more than $10 million. And those included the 4th round of our grants specifically focusing on racism, structural injustice, and its impact on child health. We hosted 23 URM first-generation low-income undergraduates in our labs over the course of the summer. We processed more than 200 new clinical and translational research study submissions through the Children's Hospital Clinical Research Intake Portal. Many, many other achievements that you will see in our annual report, but most importantly, we launched the MCHRI Office of Community Engaged Research under Dr. Anisha Patel's leadership. The mission of the office is to promote health equity for maternal and child health populations by supporting community engaged research initiatives and advancing strong collaborative partnerships between the community, academic, and policy entities. We kicked off the launch of the office with a symposium earlier this year entitled Community Engaged Research, Reducing Disparities in Our Backyard. And I think you will see over the course of today's program that bringing in extraordinary nationally renowned leaders is going to continue that conversation to help us take this to a whole new level. We had a lovely dinner last night with our guests, with our Senior Associate Dean for Research, Ruth O'Hara, and with the Dean Minor. And there's just an incredible amount of energy and enthusiasm about advancing that mission. Most importantly, we have many, many people to thank. First of all, the MCHRI staff who made this day possible. It's going to be seamless. Mary Chen, Grant Wells, Netta Miller, Dong Mei, Grizel. We are just incredibly grateful for everything they did to make this possible. The Education Committee, led by Tony Oro, manages all of our symposium over the course of the year, and they put together today's program. Their slides will be circulating, where you can see the faces of the people that reviewed well over 100 abstracts and did all the hard work all year long to put this program together. We just couldn't be here, would never be here without Packard's generous support. We're going to talk a little bit later. Be sure to be here at 1 o'clock when we give Christy Sandberg our Visionary Leader Award. But I will tell you that MCHRI started in 2005 when Chris Dawes, the CEO at the time, gave Christy $150,000. She hired Mary Chen, and here we find ourselves today. So you have to come back to hear much, much more about that. But we're so grateful for Packard's partnership, not just financial partnership, but with Rick Majzun, our COO, and many of our hospital executives on the governing board of the Clinical Research Support Office has made so much of the work over the last few years possible. And then finally, the foundation with Cynthia Brandt. MCHRI, the pillar, is some extraordinary generous gifts from the mortgages and the Basses well over 10 years ago. That's the endowment that makes everything we do possible. And every single year, we partner very closely with the foundation. The Children's Fund, for instance, is what allowed us to do the work with the URM undergraduates, the new grants around racism, social injustice. So the foundation just absolutely has been hand in hand, just an incredible partner, and the resources that come to us through the Children's Fund. So very many people to thank. So grateful to see everyone here and looking forward to a really fun day. So thank you. Dean Minor was with us for dinner last night. Couldn't be here today, but we're going to hear a few remarks from him. Next.
Good morning. I'm Lloyd Minor, Dean of the Stanford School of Medicine. I want to extend a warm welcome to all speakers and participants of this 5th annual Maternal and Child Health Research Institute Symposium. The Institute is Stanford medicine at its best, bringing together innovative, diverse teams of researchers from across the university who share a single mission: to make sure the next generation of mothers and children is happier and healthier than the last. With more than 900 affiliates from all 7 Stanford University schools, as well as our independent labs, centers, and other institutes, the Maternal and Child Health Research Institute's breadth of knowledge is awesome, and the potential limitless. Today, you're in for a truly special symposium. I heartily applaud our MCHRI leaders and event organizers for this year's inspired focus. The symposium's theme of community-engaged research is critical as we strive to eliminate barriers to care, combat health inequities, and improve health outcomes for mothers and children. Of course, as dean and as a physician scientist, I'm a major proponent of medical education. But throughout my career, I can safely say some of my greatest teachers have been my patients. So while we strive to better understand the complex social determinants of maternal and child health, it's clear some of our best sources of knowledge will be our patients themselves. Today's sessions and panels will further illuminate how clinicians and researchers can work with their communities to improve the health of every mother and child. I'll close by saying that now is an urgent and momentous time for maternal and child health care and research. And you've come to the right event to be informed and invigorated. Thank you for joining us, and have a wonderful rest of your symposium.
I guess I should say thank you, Lloyd, right? That's what you say. Everyone looks much better than in the 2-inch boxes we're all accustomed to seeing each other in. And Christy, I am really, really excited for you. I have enjoyed working with Christy for so many reasons and think it's a wonderful, wonderful tribute to her. I'm Rick Majzun. I'm the Chief Operating Officer at the Children's Hospital, stepping in for Paul King, our CEO, who is away. And really, really am excited about today. My background sort of led me down a path into pediatric healthcare a little bit unwillingly, but walking through a NICU in St. Louis and seeing that 75% of those kiddos were African American in a city where 25% of the people were African American, and then realizing that my organization would actually spend time for me to learn more about that, the intersection between what happens in the community and what happens in the hospital, was very professionally fulfilling for me. The hospitals are mirrors of our community, and I think you'll learn today from our speakers, we have some of the best scientists, some of the best emerging scientists, and some of the best community partners, not just here at Stanford Medicine, but from around the country to teach us about all the great work that's going into making, as Lloyd said, the lives of women and children better. So very, very happy to be here, very happy to help sponsor the MCHRI. It is one of the most fun things I get to do because research is a very important part of every hospital's mission, and I think we really do take that seriously here. So with that, I'll introduce our CEO of the Lucile Packard Children's Foundation, or Foundation for Children's Health, Dr. Cynthia Brandt.
Yeah. Thanks, Rick, and good morning. I'm just here to add my voice to say how grateful and exciting a day it is to be together on this important topic. I'm from the Lucile Packard Foundation for Children's Health, and we are on a shared purpose with all of you. We're all in, and our particular role is philanthropy. So some of that is about grant making that we do for children with special healthcare needs. Some of it is about fundraising we do, in part to support all of you and the work through MCHRI. We like to say at the foundation that we are here to unlock philanthropy to transform children's health and maternal health. And that kind of transformation requires the discovery, the research, the new knowledge, the collaborations that you all lead and talk about. And I think this is just such an exciting place. Stanford, Packard Children's Hospital are such great places for that work. There's no shortage of ideas. There's so much potential. And we all know that it takes resources to unlock that potential. Philanthropy is part of that mix to help accelerate the discoveries that then we get to scale up and share more broadly. So donors have the potential to bring creative, ambitious people like all of you together. I think that's part of the real excitement that donors have. I'm excited to go back and, after Mary said that the Children's Fund, which we administer through the foundation, supported the DRIVE initiative. That's something we're so proud of in terms of bringing first generation and lower income undergraduates, hopefully to this field. We're also so proud, I see Dr. Anisha Patel and some of the other folks here whose work we've been able to support through the Children's Fund. So really evidence-based, community-engaged partnerships to help improve kids and health. So we feel really proud at the foundation and proud to partner with Dr. Mary Leonard, Mary Chen, all of you, and MCHRI, and to say thank you. Thank you for this incredible work. And now I get to introduce Dr. Ruth O'Hara. Ruth is Senior Associate Dean for Research at the School of Medicine, Director of Spectrum, the Stanford Center for Clinical and Translational Research. And also, I always like to recognize the donors to endowed chairs. That's part of my thing. It's a Lowell and Josephine Berry Professorship of Psychiatry and Behavioral Sciences. So over to you.